Okay, so now, Ian, that we demonstrated the proper techniques and some things that can help you be more efficient with your change in direction, with your acceleration, etc., it's important to know that there's a foundation to that of strength and stability that is required to be able to do those skills. So
Sure.
I'm going to show you 3 exercises that we've found to be very effective with developing that stability and that strength in the lower extremity, not only to decrease the risk of injuries to your knees, hips, and ankles, but also improve your change in direction and your agility with the skills that we demonstrated.
Okay, great.
All right. So the first one we're going to do is called a single leg squat. Some people refer to this as a single leg step down. All right. You're going to do this on a block. You can do it on your staircase at home. All right. You just want to be somewhere that is 8 to 12 inches, ideally, off the ground. And what Mike is going to do is going to put his hands on his hips. This leg is basically just going to act as a gauge. It's just hanging straight. Once his heel touches on that side, that's all the depth he needs to get.
Okay.
And then he's going to come back up. The exercise is being done with his left leg. So he's going to go into a single leg squat there. Okay. Trying to keep everything level without excessive rotation. His trunk is going to flex forward a little bit so his shoulders are staying over his knee and his foot.
Okay.
His hip, knee, and ankle are in a straight line, so there's no collapse. His heel is staying down on the ground so that there is not undue stress due to any other areas. If you have difficulty getting this depth without your heel popping up, then you don't go as far low. That could indicate that you could have an ankle mobility issue.
You mean his left heel, correct?
Yes, his left heel. Yeah, it is okay if his knee passes in front of his toe.
Okay.
If the heel stays down, that just means he has really good ankle mobility.
Okay, all right.
And that's functional. That's fine. The key is that as he's going down, he's keeping his hips back. He's keeping good athletic posture and keeping stability. Okay, if you could step off, Mike, and switch sides. I'm just going to rotate this so they can see from the front how it looks.
Just one thing I want to clarify. When you said in line, hip, knee, and ankle, they'll be able to see that at home now, right? Okay.
Yes, vertical alignment of the hip, knee, and ankle without any kind of excessive rotation or collapse.
Gotcha.
If there is collapsing here, it could be an indication of weakness in your lateral hips, which we'll show an exercise to address. Okay. It could be an issue with your foot or ankle. You may be a good candidate for orthotics if you have flat feet. That could lead to excessive collapse. Okay. It could just be a weakness issue or a proprioceptive issue, the ability to have control over your body in different positions. It could just be a training issue that you just need to practice to get better at teaching your body the right way to fire.
So as far as injury prevention here, I'm assuming knees, ankle, is it hip as well?
Yes, definitely, because you're working your glutes, you're working your quads, you're working your lateral hip muscles, but you're also working your dynamic balance, which is a great aspect for ankle rehabilitation as well. So definitely hip, knee, and ankle, very strong exercise for that.
Okay.
The next one we're going to go into is called a single leg RDL. All right. In this situation, it's a very athletic movement, especially in tennis, where you may be having to reach for a ball in this position. We demonstrated it with the dynamic balance exercises in our other video.
Yep.
All right. What Mike is going to do is an isolation exercise, single leg RDL, just to work on separating his hips while keeping good mobility in his hip joints, and good stability from his hip muscles, from his glutes and from his low back and hamstrings. Okay. It's also a great hamstring active stretch. Okay, so Mike's going to start the single leg RDL. He's going to dip down, hinging at the hip, and coming back up. All right, from the side, should look like a tabletop coming down. All the motion is coming from the hip. Okay, you're not squatting up and down. You're hinging at the hip.
So his right leg should remain as straight as he can while leaning over.
Right. It shouldn't remain locked out straight.
Okay. All right.
You do want to have a hinge in it to have a more athletic, soft position, but it should not be flexing and extending as he's going through it.
Gotcha.
All right. Another thing to look at is levelness of the hips. As he's going down, is one hip rotating up or down? That could be an indication of a lateral or rotational core weakness.
Okay.
All right. So you want to try and keep everything in alignment, coming straight down and up, but also lacking the rotation as well. You want to have that good stability.
Gotcha.
And you can incorporate holding dumbbells with this, to progress the exercise. You can do it. It's a great warm-up exercise, 5 to 10 reps before you play, to really get a good active stretch of your hamstrings.
Okay, great.
Okay. The third exercise I want to demonstrate is called a lateral band walk. Probably in my experience, the #1 area of weakness in athletes with foot and ankle and knee problems is your lateral hip, is your lateral glute muscles.
Okay.
And that can cause difficulty with stabilizing your knee, and it could lead to collapsing of your knee, more rotation than necessary.
Sure.
So a great exercise would be to obtain a mini band or therapeutic tubing or a band tied up, wrapped around your ankles, and do lateral band walks. With this exercise, you're going to be working your lateral hips, but you're also going to be keeping in an athletic position, so it's very functional as well.
Okay.
Okay? So what Mike is going to do is he's going to get into an athletic position, all right? He's going to maintain this athletic position the whole time. He's not going to stand up and sit down. He's going to be level here. The only motion going on is pushing off of his back leg while the front leg pushes out.
Okay.
Okay? So go ahead and get started. As he's doing this, his feet never come closer together than the starting position. His feet remain straight ahead, no excessive rotation going on. And he has good balance and good control of everything.
Okay.
Okay? As he's coming back, same thing. Another thing to look at is when he steps forward, you don't want the lead knee to buckle. All right? It should be moving together in unison, the hip, the knee, and the ankle. Very important component of that exercise.
Can I ask a question, Ryan? When we were doing the lateral movement back and forth, kind of simulating, moving across the tennis court, across
Right.
the baseline, you were emphasizing the importance of pushing and then landing.
Mm-hmm.
But here we're pushing off with the outside leg. Is there, I guess, what's the crossover there? Now it seems like we're working on the one part we were avoiding before.
Not necessarily, because you're using your outside hip muscles with this.
Okay.
The back leg, you are maintaining stabilization while you're going this way. The front leg is, because the band is there, pushing out against the band and working your lateral hip.
Okay.
And the lateral shuffle that we demonstrated earlier, I talked about making sure that your lateral hips are doing the work with that. So this strengthens those muscles that are required to do that exercise properly.
All right. Gotcha. Just want to make sure what the difference was.
Definitely. The band is what makes the difference. The resistance, which adds, as his leg comes out, it adds that resistance to the outside of his hip there.
Gotcha.
And you could also do stationary if you're lacking space, just standing in place. You could just stand here and do some lateral pushes with it to isolate that exercise as well. It's another great additional exercise for that you can do at home. And those are 3 exercises that can really complement your speed and agility training and really help to take that aspect to the next level.
Stuff. Thanks.
Thank you.